All right, so we'll get right into our NGN next. So tonight we are analyzing cues. Analyzing cues. All right, so for analyze cues, this means that you have taken the data that they give you in your case study and you're going to connect that data to the client's clinical presentation. What could be wrong with them? You're going to determine if the data is expected or unexpected for a certain condition. So you're basically analyzing. It is your D that, I guess, the D part of the ADPI, the diagnosis, and it may not be nursing diagnosis that they'll give you. They'll probably give you medical conditions, and they'll say, what is this? What is the condition, or what is this clinical finding? What is that clinical finding related to? All right, so this board is really busy. Ooh, it's busy, busy. This is one I kind of typed up a while back. But analyzing cues is interpreting the diagnosis. You're analyzing the systems. Is it heart, lungs, kidneys? What is the system that's involved? What's in their history? What's in their labs? What's in their test results? And then you may look to see what risk factors that they have for relevance, what's relevant to formulate a diagnosis, or the possibility of a certain complication. So I think our person was all respiratory. All right, so I hope this Tell Time Thursday has helped you today. Just to recap, Tell Time Thursday means that we're looking at the tale. What is the story that these case studies are trying to tell us, and what NGN skills do we need to master to be able to answer the questions correctly and apply that to those case studies. So you want to know those Nclex tips that help guide you through those NGN skills. You want to review the NGN skills. You want to do about 10 to 20 case studies per week. That's what I recommend. And if you're doing a course with me, I will send you and provide for you at least 10 case studies a week. You want to know the types of questions that you're expecting to find. So we talked about recognizing cues. Analyzing cues is the second NGN skill. And analyzing cues, what you're doing is you're observing and you're assessing. You've already kind of recognized the observations and assessments and recognizing the cues, but now you need to analyze what you saw, what you looked, listened, felt. You want to analyze your assessment. Are there any concerns? Does the patient have any issues related to the assessment? So you want to be able to understand that so you can also analyze cues. This is actually just applying the nursing process. Once we assess the patient, we came up with nursing diagnosis, and then later we would prioritize those nursing diagnoses to help us find solutions to problems or prevent problems and come up with our plan of care. All right, so in general, analyzing cues are going to help you determine patient conditions and concepts that are consistent with the patient findings. You're going to ask yourself, out of these problems that I identified or these clinical assessments that I've seen, what can all this mean? What conditions are they consistent with? What clinical assessments are priority, maybe if especially if they're relating to a specific condition or concept? Are there any assessment findings or cues that support or contradict any specific client conditions? What other clinical assessment findings will assist in establishing significance of assessment cues for those priority concepts? So you want to mainly think about the condition, the assessment, the findings, and establish a significance of those assessments. What are those cues that are helping you identify problems? Now, these type of questions can be the most difficult. Why? Because as a nurse, you're going to have to understand physiological responses. You need to understand physiological adaptation and how the body responds and reacts when there is a certain problem occurring. And what are those common signs and symptoms that we see with different conditions? You're going to have to pull out that data that you recognize that's abnormal and interpret the data that was collected. You're going to have to use your critical thinking and decision making and allow that to also guide you in how to prioritize. Remember, patient problems are within Maslow's. So, according to the hierarchy of need, what concerns that you have about the patient are a priority. That's your hypothesis, and we'll get into that more next week. And we actually have a webinar this Saturday that we're going to be prioritizing hypothesis. If you're interested in coming to the webinar, you can just message me or leave a message here or go to my website and find out how you can join for free. Communicate and document. You got to be able to communicate those clinical findings to the providers so we can, make adjustments and treatments for those problems, or maybe prevent a potential problem, and go back and document that into your nursing notes. You have to examine a broad concept, break it down into smaller parts, and you have to simulate the information, kind of play it over in your mind, picture it, and apply it to a client scenario.